For years, we have been trying to understand the concept of health. We mainly did this by studying disease and possible cures. In mental health, we were specifically concerned with researching mental disorders and their treatments. However, there is growing evidence that mental health does not only present the absence of mental illness, but also mental well-being. Mental well-being can be characterized by feeling well in combination with optimal individual and societal functioning. Mental illness and mental well-being are related but distinct dimensions. This means that a person can suffer from symptoms such as anxiety or depression while maintaining a certain degree of well-being, or that a person is symptom-free but at the same time has a low degree of mental well-being. Research shows that well-being actually reduces the risk of mental illness. People with low emotional, psychological, and social well-being are 6 times more likely to have a mental disorder 10 years later. Knowing this, you might agree that mental health care should not only focus on treating mental illness, but also on promoting well-being. This was also the vision of Ernst Bollmeier and Gerben Westerhoff. They developed the model for sustainable mental health at the University of Twente. In this model, they state that mental health consists of the 2 dimensions, mental illness and mental well-being. However, they also mention that it is not realistic to state that life will always be without suffering, or that it will always be characterized by flourishing. Therefore, it is important to understand how people regulate their mental health and maintain mental well-being in a sustainable manner across their life course. That's where adaptation processes come in. When individuals face challenges like daily hassles, marital problems, chronic disease, or mental disorders, they are required to adapt to their new circumstances. This is done through a process in which an individual successfully interacts with the psychosocial consequences of these challenges. Temporality plays an important role in these challenges. A short-term challenge can be you missing the bus, which involves an emotional reaction and asks for coping mechanisms that reduce stress. Marital problems can be seen as intermediate challenges, which ask for communication and adopting different interaction styles, while long-term challenges like chronic illness requires assimilation and accommodation of life goals, identity, and meaning in life. Successful adaptation depends on the barriers and resources you have in life. Dysfunctional thoughts, emotion regulation, and behavior can be barriers preventing you from healthy adjustment, while resources can help you to successfully adapt to new situations. Also, contextual factors should be taken into account. Relationships, organizations, and communities may cause or maintain dysfunctional or maladaptive cognitions or behaviors that are related to mental illnesses or distress. However, positive relationships and supportive contexts can also enhance resources that promote adaptation and mental health. Improving someone's adaptation skills starts by targeting the barriers and resources and are the main focus of psychological interventions. These interventions can be placed on a spectrum. Some approaches, such as cognitive behavioral therapy or psychodynamic therapy, are primarily focused on targeting barriers, while other interventions such as well-being therapy, positive psychological interventions, or solution-focused therapy are more focused on how resources can be targeted to enhance adaptation processes. Interventions like acceptance and commitment therapy, compassion-focused therapy, or life review therapy focus on both barriers and resources. As you know by now, it is the balance that is most important in working to sustainable mental health. Therefore, this model provides a starting point for integrating a focus on complaints with a focus on strengths in mental health care.